What is the most important thing you need? Health. Your medicine and your health. This time on Science Without Walls. We are a nation of fanatics. We are fanatical about health and health care. We spend more on health and health care per capita than any other nation on earth. 15% of our gross national product, over $1 trillion per year, devoted to health care. We have the most technologically and scientifically advanced health care system in the world. We have more health care professionals per capita than most nations in the world. But we have a less positive set of statistics. We have 40 million people without health insurance or health coverage, roughly 15% of our population. Our health and life expectation statistics are not particularly good in comparison with other advanced technological nations. We ingest incredible amounts of junk food and junk drinks. We have a growing epidemic of obesity in this country. Overweight Americans, not only adults, but growing numbers of children, often very young children. Most of us won't even climb a single set of stairs, or walk up or down an escalator, or walk on a moving sidewalk. And if eating that junk food results in increased cholesterol levels and a heart attack, or if smoking those cigarettes results in respiratory problems, or if driving and riding everywhere instead of walking results in health problems, we expect medicine and medical technology to fix it quickly, cheaply, effectively. We are fundamentally a nation of health hypocrites. Now, certainly nothing of what I've just said applies to you. Hopefully you walk whenever you can, a block or two to the corner grocery store. You take the stairs up 1 or 2 floors rather than the elevator. You walk up and down escalators. You minimize your consumption of junk food and sugar water, eating instead healthy foods. You have a healthy lifestyle, but most of your fellow citizens and students do not. Your individual health is the result of 4 key factors or components, each of greater or lesser significance depending on particular health or disease conditions or situations. Lifestyle refers to food and drink intake, appropriate exercise, and appropriate rest. We can all recite components of a healthy lifestyle, and we can all recognize actions or activities which are inconsistent with a healthy lifestyle. Mental attitude refers to your individual psychology, social interactions, and environment. They all play an important role in health. A positive attitude, optimism, and low-stress work and social environments are important. Your genes, your hereditary makeup, and family history. The old joke is, pick your parents carefully, because we know now that certain disease propensities do indeed have a genetic component. And luck, just plain statistics. You can simply be in the wrong place at the wrong time. No matter how positive or strong the other 3 attributes, you may simply be the victim of some very bad luck. Well, fortunately, luck is the least important of the 4 factors. Our society seems more and more worried about health and safety. The major health fear, particularly of young inner-city teenagers, is getting shot. Until recently, that was not a major concern in Utah, but it is now, particularly along Utah's rapidly urbanizing Wasatch Front. Drive-by shootings, homicides, and interstate murders are no longer rare events. And because guns have become more commonplace, accidental shootings have become more common. There is a lot we can do to minimize such risk, including major efforts to inform and educate everyone of the risks involved in living in the nation with more guns per person than any nation on earth. This problem is a socio-political one, having to do with education, job opportunities, and social and cultural opportunities for those segments of the population most involved in such problems. That is not really a technological or scientific topic, and so we will leave it at that. Another major health fear is AIDS, acquired immune deficiency syndrome. There are 1 million Americans now infected with the HIV virus. A large number of others may have it, but have not yet been tested or diagnosed. There is particular concern about AIDS among the high school and college-age populations. How can you be sure that the person you're going out with and may eventually want to marry and become intimate with is not someone who, perhaps unknowingly, will compromise your health in the months, years, or even decades ahead? This fear has led to 3 general responses. Avoidance, which can lead to alienation and depression. A to-hell-with-it attitude, a fatalistic approach to life, behavior similar to that of the drug and gang segments of society. And carefulness or cautiousness in all social interactions. The fear of AIDS is to the current generation what the fear of nuclear war and its potential devastation was to my generation. Fortunately, the nuclear war did not materialize. The political environment has changed, so that it is unlikely that such devastation could occur today. We all hope that scientific and medical research on AIDS will eventually lead to cures and vaccines. Enhanced education and awareness are emphasizing prevention. But for now, AIDS is a very major social and medical concern. Several leading causes of death are due to infectious diseases, including AIDS. Infectious diseases account for 25% of all visits to physicians. The most common treatment for bacterial infectious diseases is antibiotics. So another major health risk and concern is the emergence of bacteria highly resistant to antibiotics. So-called drug-resistant bacteria are becoming more prevalent and commonplace in most of the world. Bacteria grow and divide very quickly. Remember, they are basically lean, mean replication machines. They also have unique abilities to scramble their DNA, playing the DNA mutation game very efficiently. So new strains evolve quickly. Many bacteria have now evolved to be resistant to our present generation of antibiotics. The good news is that we're learning a lot more about bacterial replication and division, and about other bacterial properties, so new generations of drugs are likely to emerge, which should help treat those bacterial infections. But there's also growing concern that the 5 billion or so of us on the planet are a really unique resource. Some are saying we've been underexploited in recent years by the bacteria and the protozoa. One scientist has said, quote, "Our very existence, our tools, our medicines, our antibiotics are providing an incremental Darwinian pressure on the viral and bacterial communities to evolve to make a diet out of us," unquote. A greater and greater percentage of the Earth's population live in major urban areas. So once a resistant and dangerous strain does develop, it can spread very quickly. We've also become complacent. Malaria and cholera and even tuberculosis are making major comebacks and expansions in the world today, even in parts of the United States. Some of this may be tied to changing environmental conditions, such as warming of the planet, the circulation of the oceans, and other factors. We have a lot to learn. We have learned recently that bacteria are responsible for some types of ulcers, and they may even be involved in heart disease. Stay tuned. There is a similar situation in the case of viruses. Viruses are not living organisms. They are essentially protein DNA complexes which make their way into your cells, or mine, and induce those cells to replicate the virus, making more virus, which is then released to infect more cells, and in turn make more virus, and so on. You have some mechanisms to deal with that. It's not antibiotics, it's your own internal defense mechanisms. special defense cells and special proteins which bind to those viruses, targeting them for destruction. That's what happens with the common cold and with most flu viruses. But there are viruses which are far more dangerous and even deadly. Many of them have been around for a long time, and they don't normally make it into man. An example of a natural indigenous virus is the hantavirus, which was such a scare in the Four Corners region in 1993. Its increase was probably due to a set of unusual climatic conditions, which led to a great increase in the virus's host organisms, wild deer mice. According to this recent article in Scientific American, a major cause of new viral outbreaks is due to ecological disruptions resulting from human activities. The expansion of the world population alters ecosystems that were stable, thus enhancing contact with viruses dangerous to humans. By the turn of the century, there will be over 2 billion humans living in overcrowded cities, the majority crammed into about 20 megacities, many of them in poor or third world countries, and all directly connected on almost an hourly basis to other major cities throughout the world by rapid air transport. Baggage inspection at airports is sophisticated, but it cannot screen for bacteria. Remember, there are thousands of species. They're all microscopic, and they're on and in you and other travelers. And they're generally doing good, useful, and vital chores. And there are millions of species of bacteria and protists which are not yet even categorized or discovered. There are also hundreds, perhaps thousands, of undiscovered, uncategorized viruses. As we get more urbanized, as we destroy and perturb more ecosystems, and as we rapidly move from place to place, we have to expect those pathogenic viruses and bacteria will come our way. We don't want to be paranoid about it, but we should be prepared. The United States Public Health Service, the Federal Centers for Disease Control, and state, county, and city health departments all have to be prepared to monitor, to diagnose, and to treat, to deal with such eventualities before they become severe problems, before they grow from a small number of isolated cases to major epidemics. But it costs money. No one wants to pay for such preparedness or such services. So the next time you talk with your congresswoman or governor or other elected public official, ask them about the funding and infrastructure of the U.S. and the state's public health system. They need to know that you're informed and that you care. The final health fear we'll cover is cancer. The younger, college-age population is not so concerned because the incidence in that age group is generally low. But your parents and grandparents are very concerned. Breast cancer is of particular concern to women, ages 40 to 50 and older, and prostate cancer and related problems are of concern to men, generally 50 and older. What's a woman's real chance of suffering breast cancer? Recent reports say that roughly 1 out of 8 women will suffer breast cancer sometime in their lifetime. That doesn't mean in the next 10 years or even in the next 40 years. Remember that average life expectancy today is roughly 75 years. So that means that of those 8 women whose average life expectancy is 75, by the time they reach 75, 1 of those 8 may develop breast cancer. Breast cancer is now being diagnosed much earlier and treatments are improving. So 1 out of 8 is in no way a death rate. It's a lifetime incidence rate. Also, 1 out of 8 is a very general number. If you're really concerned, you need to look beyond those numbers. Part of the reason cancer is such a problem today is that we're all living longer. Around the turn of the century, the average life expectancy was only 45 to 50 years. Today, it's around 75. The longer we live, the more chance of something going wrong, whether it's getting cancer, having hip problems, or dying of heart disease. Most of you who have an old car know exactly what I mean. It wears out. But if you do have a problem with your car, you'll often go to the owner's manual to help diagnose what is wrong. Admittedly, most things today, including your car, are probably too complicated for the average owner to repair. But you can make a possible diagnosis and maybe even a few tests before you go to the shop. When you bought your car, assuming you bought it new, there was a maintenance schedule in the owner's manual. You bring it in for maintenance, the dealer does the maintenance, signs off on it, that reconfirms your warranty, and you drive away. But you don't have an owner's manual. They should have given you one when you turned 16 or graduated from high school or maybe went through puberty, but they didn't. If you go up to the Fitness Institute at LDS Hospital in Salt Lake, you can purchase an owner's manual. It's called Maintaining the Miracle, an owner's manual for the human body. We should all have one. You don't have an owner's manual, therefore you don't really have a maintenance schedule. Many of you have health insurance plans which don't pay for periodic maintenance. Some of you may belong to a health maintenance organization, an HMO, which makes money if you're healthy and loses money if you get ill. So it's in their best interest to keep you healthy. It's like the car company wanting you to do the preventative maintenance on the car, at least during the warranty period, because if the car has a problem, it will cost the manufacturer and dealer a lot more to repair it under warranty than it costs them to encourage you to do that preventative maintenance. Health insurance today costs, on the average, somewhere between $2,000 and $3,000 per person per year for fairly comprehensive coverage. If you only have catastrophic or very limited coverage, then it is substantially less. What do you spend on your car per year? Well, the insurance policy is probably in the range of $900 a year, maybe more, depending on the degree of coverage. Your moving automobile is a massive projectile with an enormous kinetic energy capable of doing a great amount of damage to both life and property. Your insurance company is supposed to pay liability and property damage if your massive projectile becomes involved in an accident. You probably spend around $300 a year on routine service and maintenance, assuming no major problems. Depending on how much you drive, you'll spend at least $500 a year on gas and oil. So between gas, insurance, maintenance, and maybe a few car washes, you probably spend close to $2,000 a year on your car. If you're a typical college student, you spend a lot less than that on your own health and health insurance. Interesting. There are a large number of cost, benefit, risk issues associated with health care. Let's say you have a more or less typical health insurance policy, and you're a macho hot dog skier, and you blow out your knee one day on an obviously unlucky run. You want that knee patched and hopefully made functional again. Well, depending on how bad it is, it's going to cost $20,000, maybe $50,000, possibly even $100,000. Who pays? Your insurance, of course. But let's say I'm a member of the same insurance plan, and I don't want to pay high insurance rates just because my insurance company chooses to insure foolhardy, high-risk types. So should the ski resort pay? Let's say you were outside the posted area. So in principle, they have no liability or obligation whatsoever. Should the state pay? Should the federal government pay? Should the ski patrol simply bring you down, lay you in the back of your car, and leave you there on your own? Let's say you have a strong incidence of heart disease in your family, and you take a new job. Your employer's health insurance company refuses to cover you because you are a high risk. Or if you don't like those examples, let's say that you have diabetes, and now they may refuse to cover you because you have a pre-existing condition, and you simply can't afford to buy that health insurance on your own. These simple examples reflect some of the problems, some of the issues that we have with healthcare in our country. The fundamental problem is that the people with the greatest need and the greatest problems have the least political voice. They are the poor, the uninsured, the college student population. Those with the greatest political voices, the middle-aged and the middle and upper class, are generally very well insured. They don't have a problem. So who do the politicians and the state and national leaders listen to? They listen to those who have a voice. How can they even hear those who are not speaking? Here's a final example. You want to be a model or an actress, and you've read that without the proper measurements, your career will not develop. So you decide to have breast implants. It's a cosmetic procedure, so your insurance won't pay. You pay. It's expensive, but you feel it's a good investment toward your future career and earning potential. What's the risk? You have a pretty good idea of what the advantages might be. What are the disadvantages? Ask your physician what that risk is. If he or she says, there's no risk or there's a minimal risk, insist on some numbers. Ask them, what if the bag or capsule is punctured? Is it possible that there could be some local irritation? Does the procedure have any effect on your risk of getting breast cancer? Can it have any effect on the potential diagnosis of breast cancer? You must be an empowered patient. After all, it's your body and your health. You must ask those questions. And not asking them is like putting your head in the sand and essentially asking for trouble. If your physician is uncomfortable with those kinds of questions, then you should immediately change physicians. An empowered patient is one who cares enough about himself, herself, to involve themselves in their healthcare decisions. Empowered patients observe their own physiology and behavior. They are aware of scientific and technological issues, and they communicate, question, and interact with their physicians and healthcare providers. Most of us have far more communication with our mechanic than we do with our physician. Empowered patients are responsible patients. Treat your body as a scientific system. Mentally detach yourself from it and observe it regularly, objectively. Make notes. Keep a personal lab book. Make your own owner's manual, or at least maintenance manual. You occasionally check your tire pressure, your oil level, and whether your headlights are working on a regular basis. But most of us, except for maybe doing a few stretches and minimal exercises in the morning, rarely do much observation or diagnosis of our own incredible machine. Finally, if you do end up with a serious medical problem, try to deal with it positively. This great little book by Norman Cousins, Anatomy of an Illness as Perceived by the Patient, Reflections on Healing and Regeneration. Read it sometime. A lot can go wrong over which you have no control, due only to randomness, to bad luck. But there is much over which you do have control. A positive attitude, a positive outlook, a will to live. These can all be incredibly effective and important. And if you are in a hospital bed, it may be a unique opportunity to do something new and different, to learn something new, appreciate music, maybe even write a book. Our track star friend, Henry Eyring, remember Utah's perhaps best-known chemist, did some of his most important and seminal work while lying in a hospital bed, recuperating from a major auto accident. So here's hoping you do have health insurance, a caring physician, a healthy lifestyle, good genes, and good luck. We'll see you next time.
We're living in a time of inconvenience. Compassion fails me with this meanness in the air. City streets are filled with violence, so we close our doors to the city and pretend that it's not there. Here I go again, back out on these mean streets. The evil seems to cling to the soles of my feet, 'cause I'm living in a time of inconvenience at an inconvenient time. We're living in the age of communication, where the only voices heard have money in their hand. The greed has become a sophistication. You ain't got money, you ain't got got nothing in this land. This is a time of greed and power, where everyone needs to have someone to shove it round. Our children come to us for answers, listening for freedom, but they don't